Welcome to this ASN CJSN podcast. I am Farrukh Koraishy, an Associate Professor of Nephrology and Medicine at Stony Brook University Hospital in New York. Today we will discuss our article entitled Geographical and Temporal Trends in COVID-19 Associated Acute Kidney Injury in the National COVID Cohort Collaborative, published in CJSN this May. Acute kidney injury is associated with higher mortality in patients hospitalized with COVID-19. However, a comprehensive assessment of its incidence, geographical distribution, and temporal trends since the start of the pandemic are not fully described. In this study, we tried to address these deficiencies in existing knowledge. We conducted a retrospective cohort study of over 300,000 patients using electronic health record data obtained from 53 health systems in the United States in the National COVID Cohort Collaborative, also known as the N3C. We selected hospitalized adults diagnosed with COVID-19 between March 6, 2020 and January 6, 2022. AKI was determined with serum creatinine and diagnostic codes. Time was divided into 16-week periods called P1 to P6 and geographical regions of the United States into Northeast, Midwest, South, and West. Multivariate models were used to analyze the risk factors for AKI or mortality. Our key findings were overall 38% of adults hospitalized with COVID-19 experienced AKI. Of the total cohort, 17% lacked a diagnostic code but had AKI based on change in serum creatinine. These individuals also had higher mortality compared to those without AKI. The incidence of AKI was highest in the first wave of the pandemic in the United States, then decreased subsequently and remained stable thereafter. Compared to the Midwest, the South and the West regions continue to have the highest relative odds of AKI over time. To our knowledge, this is the largest study to analyze the incidence, geographical and temporal trends, risk factors, and mortality associated with AKI in patients hospitalized with COVID-19 since the start of the pandemic in the United States. The decrease in the incidence and severity of AKI as well as mortality after the first wave of the pandemic might be related to the characteristics of the patients. In the first pandemic wave, there was a greater relative proportion of males and greater severity of illness compared to the subsequent time periods. The higher risk of AKI in the South and the West regions might also reflect patient characteristics. The South had the highest proportion of Black patients and those with comorbidities, while the West had the highest proportion of males and Hispanics. Both regions had patients with greater severity of illness compared to the Northeast and Midwest. The incidence rate of AKI in our study was 38%. However, our estimates would have been lower, around 22% if restricted to the use of diagnosis code only, and also lower, around 31% if restricted to the use of serum creatinine alone. Our study had several limitations. We might have missed a significant number of AKI cases due to the lack of data on urine output. Furthermore, our temporal and geographical trends in AKI incidence might have been impacted by factors not included in the study, such as changes and differences in management of COVID-19, in the virulence of SARS-CoV-2, the type of medical centers included in the N3C database, and finally the rates of vaccination and mask use. In conclusion, we report that the incidence of COVID-19 associated AKI has decreased after the first wave of the pandemic in the United States, and we observed regional and temporal differences in AKI and mortality rates. Thank you for joining me in the CJSN podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.